Hello everybody and welcome again to lyranara.com, your leading holistic health provider for North America and the world. And today we've put together another great presentation for you about an amazing system called the Biotonometer. So this is a system that evaluates your autonomic nervous system and allows you to determine imbalances in the body and therefore illnesses, and also develop and track therapies, see if your therapy clicks well with the patient by measuring the reaction of the autonomic nervous system while after you've applied the therapy. But Dr. Rilling, the developer of this system, was well ahead of his time, and he has become a very, very well-known and regarded and respected personality in this field. He is also called the father of biotonometry, therefore, and I think there is no other device on the market that can give you what the biotonometer can give you, and we're gonna show you in detail how the autonomic nervous system works, while it's important to evaluate it, go over a little bit of the biography of Dr. Rilling, of course, show you real life examples of patients have been treated and the progress of the therapy has been tracked using this device. And at the end, I think you're going to be just as convinced as we are that there is no other device on the market that can do the same. And so without further ado, let's dive right into it and show you all about the biotonometer. So let's start by talking a little bit about Dr. Siegfried Rilling, the inventor of this device, and explain to you what is biotonometry. Well, the biotonometry deals with the measurement of the autonomic nervous system. It's very simple. And this guy, Dr. Rilling, he was working for 56 years in medicine, holistic health, and he said that I could not have treated my patients with such a success without biotonometry and the device I created, the biotonometer. Dr. Rilling identified the importance of the device as a compass system to treat patients. And now you may ask yourself, well, if it's so successful and has been used for so many years, why is it so unknown? And was asked this as well while he was still alive. He became 93 years old, by the way. And he said, I reply to all of you to this question. The introduction of the frozen food took 83 years. Accepting steam navigation at least 38 years. TV and computers were introduced 20 years after being invented. So he wanted to point out to you that, well, sometimes good things need a while until they precipitate into the mainstream. Doesn't mean that there is not a lot of data about this device being used all around the world with amazing results. And as I said before in the introduction, we're going to have a look at real life examples of this later on in the presentation. First, let's have a look at the autonomous nervous system. It's also called a vegetative nervous system, and it's a system containing most motor neurons supplying the glands, smooth muscles, and the inner organs and heart. It's called the autonomic or vegetative nervous system because it works without the centers of the cerebral cortex, and thus it functions without a conscious mind control. It works with the hormonal system together, and it is controlled by the hypothalamus and the brainstem, especially by the medulla oblongata and the brainstem pons. The ANS is responsible for all of the vital functions like blood circulation, your heartbeat, your breathing, your body temperature regulation, blood pressure, as well as the control of gastric juice secretion. So what are the components of the ANS? It consists actually of two parts that work antagonistically. It's the sympathetic nerve, also called S, and the parasympathetic nerve, P, or also called the vagus. All sympathetic fibers pass the sympathetic trunk, a ganglionic chain on the left and on the right of the spinal cord. The parasympathetic path crosses the 3rd, 7th, 9th, and 10th cranial nerve or vagus, and some nerves emerging at the sacrum. The vagus leads to all organs in the thorax and the abdomen. All vital inner organs are also always regulated by two motor nerves, S and P, acting antagonistically, one activating and one sedating the functional activity. It's the yin and yang principle of autoregulation. So why is it so important to look at the autonomic nervous system? Well, the answer is very simple, because it affects all of the organs' functionality. And here we have a nice table depicting this. It shows the effector organ, the function of the sympathetic nervous system, and the function of the parasympathetic nervous system. For example, here for the eye, the sympathetic nervous system regulates core diastasis, contraction of the ciliary muscle for close vision, and then the parasympathetic regulates the contraction of the pupil. Again, you can go through all of those each by just pausing the presentation. For example, for the heart, the sympathetic nervous system increases the beat frequency and beat strength. It also extends the coronary vessel and reduces the transmitting time. The parasympathetic here, for example, it slows down the beat of the heart, it contracts the coronary vessels, and it extends the transmitting time. And so it goes for all of the vital organs in your body. One activates and the other one sedates. And as I said, pause please the presentation right here to have a closer look at each one of them and how the system works. Here we have a closer look at the sympathetic part of the autonomous nervous system. You can see where it's located in this nice graph and what it causes. For example, for the eyes, it's a core diastasis. For the mouth, it inhibits the salivary glands. For the skin glands, it activates sweat. For the lung, it extends the air passages. For the heart, it accelerates its frequency. For the stomach, it inhibits gastric juice secretion. The liver, it releases glycogen into the blood. For the intestine, it inhibits the digestive process. The pancreas, it prevents the secretion of digestive enzymes. For the kidneys, it inhibits urine formation. For the bladder, it inhibits urination, and for the rectum, it contracts the rectum. And then we're going to have a look at the other side of the equation, the parasympathetic. So here we can see the parasympathetic or the vagus nerve. And again, as I said, it's working antagonistically to the sympathetic. So for the eyes, instead of diluting them, it contracts the pupils. For the mouth, it activates the salivary glands. On the skin, it has no effect. On the lung, it gives you a stenosis of the air passages. For the heart, it's a retardation of the frequency. Stomach, it's an activation of the gastric juice secretion, and so on and so forth. So it's just the contrary of what the sympathetic nerve does. So after we've taken a look at how the autonomic nervous system works and why it's important, just because it affects all of your vital organs, let's see how we can measure its activity. So this measurement of the autonomous nervous system activity is called biotonometry, and it's the only method which makes it possible to record ANS's activity in seconds. It works by electronics, measuring the same time the resistance, the R value, and the capacity, the C value. Biotonometry is the single method capable to measure ANS correctly, and opposite to many other methods which consider they can achieve this too, that have not proven themselves as being effective. This one has proven itself over the years to really work. The P and the S activity is influenced by the following data that is being measured: the mineral balance and trace elements, acidosis and alkalosis, so pH ratios, the redox system, the temperature or pulse, chronobiology, as outlined by Hoff 70 years ago, and the nerve conduction system and glands. What do we mean by resistance and capacity? Well, the tissue's resistance is significant for the P nerve activity, so the parasympathetic, and the tissue's capacity is significant for the sympathetic nerve activity. With biotonometry, you can work out a better treatment by learning in detail about the course of the disease stages which are mirrored in the ANS's activity. Healthy individuals show the following normal range of R and C values. R value is 8 to 15 coulombs. C value is 0.15 to 0.25 microfarads. The sympathetic dominance range is 1.5 to 8 coulombs and 0.25 to 0.5 microfarads. And the parasympathetic dominance range is 15 to 150 coulombs and 0.03 to 0.15 microfarads. There are no gender differences, and children are more S dominated with a value of 6 coulomb and 0.27 microfarads, and elderly people have a higher P dominance with R values higher than normal. The measured values can then give you insights about a therapy to be applied. The normal P and S range does not mean that the patient is 100% healthy, though. It means only that he was balanced properly and treated correctly, and his body is auto-regulating correctly. So for bringing in relation the ANS and the organic diseases, Dr. Rilling developed something that is called a balanced beam system, and it's a nice graph that has the resistance on the left-hand side and the capacity on the right-hand side. And depending on those two values that are being measured through his system, you can determine the relationship between the organic diseases and your autonomic nervous system. Here we can see how a vagus irritation looks like, and if you look at a graph, you can see that, for instance, a contraction of the gallbladder on the side of the vagal excitation is accompanied by an atonia of the sphincter and an increased urine outflow on the side of the sympathetic paralysis at the same time. A vagal excitation is also accompanied by stimulation of the external hippopancrearia and inhibition of the thyroid secretion in this case. So let's look at the other side of the equation, at the sympathetic irritation. In this instance, we see in this graph on the side of the sympatheticus an irritation that is accompanied by a glycogenolysis of the liver, and on the side of the vagus a paralysis, just the opposite of what we've seen before, and this is accompanied by a decrease in salivation at the same time. Stimulation of the thyroid secretion stands on the side of the sympatheticus irritation with an increase of blood circulation in the muscles, also known as tremor, and as known chorodiastasis. At the same time, vagus paralysis with an atonia of the gallbladder and inhibition of the gas secretion of the liver can be seen. And here, if you have a P and S dominance, what are the symptoms in detail? And S irritation is accompanied by the following typical symptoms normally. Glycogenolysis in the liver, thyroid excessive secretion stimulation, increase of the blood circulation in your muscles, tremor, also known as chorodiastasis, and P paralysis is accompanied by the following typical symptoms: a decrease in salivation, atonia of the gallbladder, and inhibition of the bile secretion. Let's have a closer look at how easy it is to take measurements with a biotonometer. It's a very intuitive device. It measures in seconds the status of your autonomic nervous system. The patient just takes 2 hand electrodes in his hands. We press the button for testing or measuring, And after 1 second, the values of resistance in COM for vagus and in C and the capacity in microfarad for sympathetic are shown. After 5 minutes, the device switches itself off automatically, and the data is then transferred to a computer that evaluates the results and then visualizes them. To create the ANS profile, it is necessary to control a measure every 10 to 30 minutes the ANS status, and the final results will then be displayed after those 30 minutes. The progress in the treatment can also be recorded and evaluated after 90 minutes or after several days. So very simple to use and to understand, and very nice to use to track your progress or the patient's progress in his illness or in his cure. So let's have a look at some real-life examples of patients that have been measured with the biotonometer and how the progress was. First we have Walter here. He was a male of 72 years and he complained about heartaches. The doctors recommended to him that he undergoes a heart surgery. He was treated with a heart-specific preparation of strophanthus, and a medication shows a reactive behavior in the graphs that you can see below. After 90 minutes, the last measured final value was 20 points lower already. So here you can track how this medication, strophanthus, exactly affected his autonomic nervous system, and you get very quick insight in if it's efficient or not. And the patient lost eventually his local heart and chest pain, so the whole treatment was very successful. And the tracking of this through the biotonometer was key to this success. Next up, we have Wolfgang. He's male, he's 68 years old. He had colon cancer with metastasis. Treated with Spengler-Salm Coledoron and 25 drops of it. The curve shows a clear decrease with a synchronous C value decrease, and after 60 minutes both R and C values increase again. Within 90 minutes you see already an improvement in the value. The output was then only 36 com, and initially it was 84 com. So again, the results of the natural medication that was given here can be clearly seen and tracked. Another patient whose progress was tracked and his ANS values were measured by this biotonometer system is Siegfried, 82-year-old male. He had multiple disorders: cardiac insufficiency after an emergency operation of the perforated colonic diverticulum, and senilities. He was treated with Vitorgan as 80, 68, 70, and 71 for neurotherapy, and the curve shows a clear decrease of the R values from 78 to 42 coms, and the C value was little reacting to therapy, meaning that the therapy was well tolerated by this patient. R at the therapy starting point was 78, and the R value after 90 minutes went down to 38 coms only. The therapy was very successful therefore, and again it was very easy to track the success of the therapy with the biotonometer. Next up is Inge. She is female, 83 years old. She was suffering from polyrheumatic syndrome, arthrosis, and circulatory disorders, as well as diabetes. She was treated with Vitorgan product, the Revit Organ 43. And again, we have a look at the curve, and it shows a clear increase of the R values, then a decrease, finally heightened values within 90 minutes, meaning that the therapy again was very successful. Another female patient, Ursula, 66 years old. She had mammal cancer, metastasizing. She was treated with ozone oxygen and homeopathic immunotherapeutic Vitorgan preparation. And let's have a look at the curve. The curve shows several strong reactions of the autonomic nervous system. Thereafter, the health condition stabilized significantly. The patient is experiencing well-being nowadays. The changes in the curve also show the tendency of normalization, indicating that the therapy was very successful. Here we have the curve of a patient that unfortunately could not be treated successfully anymore. She also was suffering from mammal cancer with multi-sided metastases. Extreme malignancy was determined by the histological examination. She was treated with some white organ combinations, ozone intramuscular, arthrochelan, and administered separately on different days. But here again, the device, what we wanted to show you is how the device was already predicting and tracking how the autonomic nervous system was reacting, and already indicating that unfortunately this therapy did not show any success. The curve of the C values does not react anymore, so the prognosis was bad, and unfortunately this patient died shortly thereafter. So still, we wanted to show you this because, again, the biotonometer indicated very precisely that those preparations that were administered to her, unfortunately, in her case, did not show any success. But let's move on to a more successful story of a treatment, and again, of how with the biotonometer the whole progress was tracked. And predictions could be made. His name is Eckhart. He was 45 years old. He was suffering from seminoma and secondary esophagus carcinoma. He was treated with white organ combinations, arthrochelan, ozone intramuscular, administered separately again on different days. The curve, as we can see here, peaks from a single administration of the medication already, indicating a good result. So this patient reacted to this very well, and he significantly prolonged his life doing this treatment. And all of the progress of the treatment was, of course, again accurately tracked with a biotonometer. Another patient that was suffering from severe conditions like metastasizing hypernephroma and sympathic cancer shown in the original curve also, was treated with additive non-toxic therapy according to Dr. Rilling. The curve here peaks to R value 64 with an antagonistic behavior in the C curve, which indicates a positive reaction of the immune system, and the patient prolonged his life for more than 5 years with a good life quality. Next up is somebody who didn't want his name to be published. He's 88 years old and male. Here we can see a long-term curve that goes over 3 years. He was suffering from bronchopneumonia, and he was treated with Spengler Sun-G every second day, twice a day, 15 drops. The interval ozone therapy also with 600 gamma each. And if we look at the curve, whereby, by the way, the R values are on top, as you can see, and the C values are down below, it shows heightened R values, thereafter step-by-step normalization, which gave a good prognosis to this patient, and he's still happy and doing well nowadays. So after looking at what the biotonometer can do, how it works, and some real-life examples, how it has been helping therapists all over the world with real patients to follow up and determine their treatment. Let's come to some conclusions. Well, first, thousands of cases have been realistically treated and measured with a biotonometer over the years. There is no other device which can evaluate ANS and guide you during the most suitable therapy application so far on the market. It's based on measured RNC values. It can be avoided. You can avoid an irritation of either the paranormal or the parasympathetic, and the sympathetic nervous system. Especially in case of parasympathetic cotonia, the irritation may be a result of wrong medication that can be avoided through this device. Placebo effects can also be measured, interestingly enough, with this device. And good therapies must be customized, of course, and not apply the standard care procedures. And that's where the biotonometer really comes into place. It helps you customize the treatment to exactly what your patient needs, and you can track real time almost how the response in his body is. The biotonometer measures live, therefore, the effects of any therapy, any dosage, on any kind of patient and for any kind of known health condition. It's very fast, as we've shown you already. The results are realistic, they are reproducible, and it's very cost effective to use this device. Therefore, I would say the biotonometer must be in any practice, clinic or hospital that offers holistic health. And we would say though that you should do it together with your health practitioner. It's not recommended to be used by patients alone because a doctor must evaluate the results, and so it's more for professional use, but still it's for your holistic practice. It's something that you should not do without. And if you have any further questions, again, please contact us anytime at www.lyronara.com. You can also reach us toll free, of course. Follow us on Twitter and Facebook and on YouTube, of course. We put out valuable material about health conditions and how to treat them every week. And if you've enjoyed this presentation, please share and like and subscribe to our channel. There is much more where this came from. Thanks again for your attention, and see and hear from you next time.